My name is Dr. Lee, and I will be talking about medical terminology today, and I will give you, in today's lesson, a brief introduction of medical terminology and how to understand even difficult words by breaking it apart into its component words. And I will give you several examples of medical terms. So please pay attention, and I am pleased to be here. If you are following along with me in the PowerPoint, I'm going to start on the second slide. Basic root words, prefixes, and suffixes. So the root word is the word that every other word is, that a word is constructed from, and you have a prefix and a suffix. Prefix is a fragment of a word that comes at the beginning, and the suffix is a part of the word that comes at the end. The root is the glue that holds everything together. So, word analysis. Medical terms are like jigsaw puzzles. You can divide the word into its individual parts and learn the meaning of each component. There are 3 word parts. Root words, sometimes also known as combining forms, contain the meaning of the term. Usually, a root word indicates the body part that is involved. A suffix typically represents the disorder, disease, condition, or procedure. A suffix is always at the end of the word. A prefix generally indicates a number, time, location, or status. A prefix is always at the beginning of the word. So, using these concepts and understanding, let us do an example. So, you combine vowels using a slash as a separator. So in this example we have here electro / O / cardi / O / gram. So the first part, which in this case is known as the prefix, electro means electricity. The word cardio refers to the word heart and the organ of the heart, and it is the root word, which is in the center, as you can see. And finally, the word gram is the suffix, and it means to record. So, you usually read the meaning from the suffix to the prefix, backwards to forwards. This, in all, can be read then as record of, or record the electrical activity of the heart. Many people wonder what the O means. So as you can see, there's an O between electro and cardi, an O between cardi and gram. So O is known as a combining vowel, and it will help you divide the word into its parts. O is the most commonly used combining vowel. You will find a combining vowel used when the suffix begins with a consonant. The word consonant in English grammar means anything that is not A, E, I, O, or U. On the next slide, here is another example. The word is cardiomegaly. So, in this case, there is no prefix. But we have a root word, the same root word from our previous example, cardio, which means heart. The suffix in this case is megaly, which means enlargement. So again, reading this term, we have an abnormal enlargement of the heart, and that is the meaning of cardiomegaly. On the bottom right, you can see a picture of a normal heart, and on the bottom, the right side of the picture, you can see that the heart muscle becomes too thick, and this is the condition of cardiomegaly. and hypertrophy. Hyper means too much of something. Trophy is a word that means growth. So you can see that the heart muscle has grown abnormally large, and this is what's happening in certain disease conditions of the heart. The next few slides have a bunch of medical root words, prefixes, and suffixes, and their meanings. So there's a lot of information, but in medical terminology there are so many more terms than what is given here. This is just a brief sample. So let's go into it. A means not. It's a medical prefix. Another prefix is ab, ab, which means away from. Ad means toward or near. An means not. So the first four words here were all prefixes. The term andro means male. The word anti means before or in front of. The word anti means against, opposing, or contrary. The term bio means life. The term cardio, which was a root word, means heart. The term cardium means heart. Colpo means the vagina. Cyst means the urinary bladder. Site is a medical suffix, and it means cell. The term dist means far away from an anatomical structure, and this is also a prefix. The term ectomy means removal through the means of surgery. The term emia means a deficiency of a substance within the blood vessels. Entero means intestines, particularly the small intestines. The term endo means within or inner. The term epi means on or upon, and it is a medical prefix. Gastro means stomach, and it is a root word. Gyno or echo means female. The term hemato means blood. The term hemi means half. The term hyper means too much of something. The term hypo means deficiency of something. The term hystero means the uterus. The suffix ism means a condition of. The suffix itis, which is seen many times in medical terminology, means inflammation or infection. The term cal means potassium. The term laparo means the flank or the abdomen. The term meno means month. The term metro means a measure, as in time. The term myelo means the spinal cord. The term myo means muscle. The term natri means sodium. The suffix ology refers to or means the study of something. The term oma means tumor. The suffix oscopy means viewing structures using a scope. The suffix osis means a process, condition, or state that is usually abnormal or diseased. The term osteo means bone. The term otomy means to cut into a part of the body. The term paresis means weakness. Plasia means growth or formation, and plegia means paralysis or stroke. The term pnea means breath or respiration. The term post means after or behind. The term pro means in favor of or promoting. The term prox means near to or closer to an anatomical structure. The term psycho refers to the mind. The term pulmono refers to the lungs. The term raja means excessive flow or discharge. The term vascular means blood vessels. On the next slide is a picture of the human body and what are called planes. So planes are cross sections that can divide the body into different segments. The coronal plane is a plane that can separate the body into a front side and a back side, and it goes through the middle of the person. Another plane that goes through the middle of the person but separates the individual into a left side and a right side, this is called the sagittal plane. Then there is another type of plane which is horizontal called the transverse plane, and it divides the person into top and bottom. And in concluding this lecture, I want to talk about some of the terms that refer to the positioning and anatomy of a person. Cranial means toward the head. Cephalad also means toward the head. The term caudal means towards the tailbone. The term proximal means near to or closer to an anatomical structure. The term distal means far away from the anatomical structure. Sagittal, as I mentioned earlier for a sagittal plane, is a vertical plane passing through a structure, bisecting it front to back, and separating it into a left and right section. Coronal is a vertical plane which is perpendicular or at right angles to the sagittal plane, and it passes through a structure and separates it into anterior and posterior sections, otherwise known as front and back. Axial or transverse is the horizontal plane which separates a structure into a top and a bottom section. The term prone means face down. The term supine means face up. AB or abduction means to move away from the central plane. Adduction means to move toward the central plane. Inversion means to turn a structure inward. And finally, eversion means to turn a structure outward. So there was a lot of material in this intro open class regarding medical terminology, and I could only give you a brief introduction to medical terms, but understanding this, I like to tell my students, is like learning a new language. And just like learning a new language, there are rules of grammar, and by understanding medical terminology's components of the root word, the prefix, and the suffix, it can help you understand very large and difficult words and make them very simple. At this time now, I am free to answer any questions you have, or we could also do an example or two to further enhance our understanding of this concept of the root word, medical prefix, and suffix. Thank you everyone for your excellent participation, and now I am free in the remaining time to answer any questions you have about either the lesson material or anything else regarding my practicing in America, or whatever you want to ask me about. I am free for a few minutes, so go ahead and don't be shy, ask away if you have any questions. Also, I will be teaching another class, so please stay tuned for that one. It will be on the heart. So check the schedule, and I will be teaching again the next time. So I will see you again.